You swallow a pill. Within 20 minutes, the pain in your back starts to fade. You feel calmer, clearer, better. There's just one problem. The pill was sugar. Nothing inside it could touch your pain. So what actually healed you? The answer isn't fake. It isn't in your head in the way people usually mean that phrase. Something real happened inside your body triggered by nothing but belief. How is that possible? Go back to the 1950s. An anesthesiologist named Henry Beecher was treating soldiers on the battlefield during World War II. Morphine supplies kept running out. In desperation, nurses sometimes injected wounded soldiers with plain saline solution and told them it was morphine. Beecher watched something that shouldn't have happened. A significant number of soldiers reported real pain relief, even in the complete absence of any drug. He carried that observation home. In 1955, he published a landmark paper called The Powerful Placebo, reviewing more than a dozen clinical trials. He found that across a wide range of conditions, roughly a third of patients responded to treatments that contained no active ingredient at all. That number startled the entire medical field. It suggested that belief itself might be doing something measurable inside the human body. Feel the weight of that for a second. Not imagined relief. Not patients pretending. Measurable physical change produced by expectation alone. Scientists spent the following decades trying to explain how. Here's what they found. When you believe a treatment will help you, your brain doesn't just sit back and hope. It gets to work. Your brain releases real endorphins, your body's own natural painkillers. It can shift the activity of dopamine, the chemical tied to reward and relief. In some documented cases, it can even influence your immune response. Your body's chemistry can change measurably, all triggered by a belief that turned out to be false. Why would your body do that? Think of it this way. Your brain is constantly predicting what's about to happen to you. It runs on expectation, not just raw sensation. If it expects relief is coming, it starts producing some of that relief in advance, before the real cause even arrives. Expectation itself becomes a kind of trigger, wired directly into your biology. There's a particularly strange twist waiting in this story. In the early 2000s, an orthopedic surgeon named Bruce Moseley ran a study on patients with severe knee pain from osteoarthritis. Some patients received real arthroscopic surgery. Others were wheeled into the operating room, given anesthesia, and received 3 small incisions on the skin. No actual surgical repair took place. Just the incisions, the sounds, the entire ritual of surgery. A year later, the sham surgery patients reported just as much pain relief as the patients who had the real procedure. Read that again. Fake knee surgery relieved pain as effectively as real knee surgery, at least by the patient's own reports. It wasn't the scalpel doing the work. It was something about belief, ritual, and expectation, wired into a system your surgeon never touched. You might assume this only works if you're fooled. Here's the part that breaks that assumption completely. In 2010, a researcher named Ted Kapchuk at Harvard Medical School ran a trial with patients suffering from irritable bowel syndrome. He gave them pills in bottles that were openly labeled placebo pills, containing no medication whatsoever. He told them in plain language exactly what the pills were. No deception, no hidden trick. The patients still reported significant symptom relief, nearly double the improvement of patients who received no treatment at all. Just knowing they were taking a fake pill inside a structured ritual of care was enough to trigger real change. That single study rewired how researchers think about the placebo effect entirely. It isn't only about deception, it's about ritual, attention, and the felt experience of being cared for. Now flip the entire idea over because it gets darker here. If belief can heal, belief can also harm. Researchers call this the nocebo effect. In one striking case study, a patient in a clinical trial swallowed dozens of pills in a suicide attempt, expecting them to be lethal. He was rushed to the hospital in genuine, measurable medical distress, low blood pressure, and dangerous symptoms requiring intervention. The pills were inert placebo tablets from the trial he'd been enrolled in. His body responded to what he believed was happening, not to what was actually inside the capsules. Sit with that for a moment. The same mechanism that heals you can hurt you, purely through expectation. Your body doesn't distinguish belief from chemistry the way you'd assume. It treats a convincing expectation as data worth acting on. This isn't limited to pills and operating rooms either. Researchers have studied it in everyday life. In one experiment, hotel housekeepers were simply told that their daily work already met recommended levels of exercise. Nothing about their actual routines changed. Weeks later, that group showed measurable improvements in weight, blood pressure, and body composition compared to housekeepers who weren't told this. Belief about their own activity level appeared to shift real physiological outcomes. Here's where this gets genuinely useful for your own life. You already sit inside placebo-like effects constantly, whether you notice them or not. The ritual of your morning coffee, the ceremony of a doctor's white coat, the 10 minutes a good doctor spends actually listening to you. Every one of these carries a measurable healing signal layered on top of whatever medicine or treatment is actually happening. That's not fake. It's a second, real biological effect stacking on top of the first. That doesn't mean belief replaces medicine. Nobody is telling you to skip antibiotics for a real bacterial infection because you feel hopeful. What it means is different and arguably more interesting. It means your mind and body were never as separate as you were taught to think. The line between psychological and physical starts to blur the moment you actually study it closely. Think about your own healthcare experiences for a second. Have you ever felt noticeably better the moment you left a doctor's office before any medication had time to work? That's not your imagination lying to you. That's the same mechanism Beecher documented on a battlefield, Mosley documented in an operating room, and Kapchuk documented in an open-label trial where everyone already knew the truth. So think back to that sugar pill from the beginning. It was never doing nothing. Your belief flipped on a set of biological systems that were real, measurable, and entirely your own. Systems your body had been carrying the whole time, just waiting for the right expectation to switch them on.